Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hey, good morning, Amarillo. So, you're driving around town and you need to stop for gas. You've been running some errands and you're running low on fuel and you need to stop to fill that tank up. And you look up and on one side of I-40, they're selling gas for $3 a gallon. And on the other side of I-40, there's another gas station and they're selling gas for $15 a gallon. Now, I know it may sound like a crazy question. We're going to get into it today, but where are you going to stop and fill up? You going to pay $3? Are you going to pay $4? Now, I know it's a silly question. It's almost like, Josh, come on, that's just common sense. Of course I'm not going to pay $15 a gallon when I can get it for $3 across the street. But let me tell you something, folks. When it comes to healthcare and the way we consume healthcare and the way we pay for healthcare, millions and millions of people are doing the equivalent every day of buying $15 gas, and they don't even know it. They don't even realize it. And we're going to get into it today. Let's go. My name is Josh Butler. I'm the president of Butler Benefits and Consulting. I'm a healthcare consultant and advisor. We're located right here in Amarillo, Texas. I help organizations and companies reduce their healthcare and benefits costs while simultaneously improving their access to high quality and affordable care for both their organizations and their employees. And each week, right here on this program, I'm sharing solutions and strategies to give businesses like yours and their hardworking employees a snowball's chance in healthcare. That's the whole purpose of this program. So let's get back to this question. Now tell me, who in their right mind is going to pay $15 a gallon for gasoline when you can obviously get it across the street for $3 a gallon or get it for $3 a gallon somewhere else? Well, I can tell you who would do something like that. Lots of people would do that if we purchase gas the same way that we purchase healthcare in this country. So y'all have heard me say this multiple times on this program. Healthcare is the only thing in the U.S. economy that I can think of that people purchase before we ever know the price or before we ever know the quality of what we're buying. And we don't purchase anything else that way. And I can also tell you this, if gas stations were not required to show you the price of gas before you filled up, or if you had gas insurance, where you would only have to pay a copay or maybe a deductible each time you filled up, well, I guarantee you one thing, lots of people would be overpaying for gas. The majority of us would be overpaying for gasoline too. Lots of people would stop caring about the ultimate price of gas, the actual price of gas, because after all, they would only be concerned with what their copay was or what their deductible was. And that's what's happened in healthcare, ladies and gentlemen. Meanwhile, as this game plays out year after year after year, people watch their gas insurance. It gets more expensive than their mortgage payments. And, for so many people out there, I can tell you family premiums now are reaching $2,000, $2,100, $2,200 per month just in monthly premiums. And I know lots and lots of people that their mortgage payments aren't even $2,200 a month. So one of the big issues is price transparency and the lack of price transparency in healthcare. And I'll tell you guys, price transparency, as much as almost any other factor, it drives competition, ladies and gentlemen. When two gas stations are competing for your business and one's $3 marked price and one's $15, you know who's going to get all the business. But for years and years and years, we haven't had price transparency in healthcare. Okay? Now, that's all starting to change. Y'all have heard me talk about the Consolidated Appropriations Act several times on this program. We had a whole episode about it a few weeks ago, and you've heard me speak on that topic, and I'm going to continue to speak on that topic because price transparency is a huge deal in healthcare, guys. It's a huge deal. And today we're gonna get a little bit more specific when we talk about price transparency. Okay, we're gonna simplify things for you a little bit. Today I'm gonna share with you just how much price variance exists in healthcare, like the difference between $3 gas and $15 gas. You may think that that's hyperbole. You may think that I'm over exaggerating, ladies and gentlemen, but I can assure you I'm not. And price variance is a real thing in healthcare, and it is happening right here in Amarillo, Texas. And people need to know just how much something actually costs. I'm not talking about what your copay is. Everybody knows what their copay is. I'm not talking about what your deductible is. Everybody knows what their deductible is. But very few people actually know the ultimate price and prices that are being paid in our healthcare system. And it makes a whole lot of a difference. It makes a whole lot of it makes a difference because ultimately we are the payers of healthcare, ladies and gentlemen. Just a few weeks ago, I did an episode over, about who the true payers of healthcare are in this country, and it's us, ladies and gentlemen, businesses and their employees and taxpayers. We are the one that are either directly paying for healthcare services or we're indirectly paying for it through things like, premiums. That's an indirect payment of healthcare services, okay? It's actually a future payment for a healthcare service, whether it's ever rendered or not. Imagine that. It's like you're going to pay me for a service and you may not even end up using the service, okay? But if we're going to ask people to be better patients and to be better consumers of their healthcare, then you need information and you need resources. You need better resources and better information to be a better consumer. And that's what we're going to do today. We're going to drill down today, ladies and gentlemen, into some specific areas where you can get a good sense of just how much price variance there is right here in Amarillo, Texas when it comes to healthcare, and how much you're paying at one facility versus another facility, at one location versus another location. And you're also I'm going to show you some examples of the price variance that exists even among insurance companies. If you're with Blue Cross Blue Shield is paying a much different price than United Healthcare, than Aetna, than Cigna, than IMS, than any other payer. You're calling them, they're not true payers. We're the payers. But you're going to see the price variance in these examples, okay? And as I go through a few of these examples, I want everybody to think also about not just the variance that exists when it comes to price, but also the variance that exists when it comes to quality. Not all doctors are created equal. Not all hospitals are created equal. You think every spine surgeon out there in America is equally skilled? You think they all get the same quality outcomes and that all the outcomes are the same? Of course they're not. Of course surgeons don't get the same outcomes. And you can just don't go any further. Ask Tiger Woods and Steve Kerr. Coach Steve Kerr, he's undergone multiple back surgeries because he had a back surgery. His initial back surgery was done by a surgeon, and it was a relatively routine procedure on his back, but the surgeon nicked his dura, which is around the spinal cord, and that led to a spinal cord leak. When that happened, Steve Kerr went downhill really, really quickly, and he started to have many complications due to that medical error. And for 2+ years, he had to go undergo multiple other surgeries and procedures, and he sustained unnecessary pain and suffering for 2 years. And not to mention all the additional costs that were associated with his surgeries to correct that initial mistake. So keep in mind that variance exists in quality too, not just in price, but today we're going to focus in on price variance here in Amarillo. So since I was on that topic of spine surgery, let's go ahead and continue on that topic. It's a DRG 473. Now, for those of you that don't speak medical coding language every single day, a DRG is a procedure code for a cervical spine fusion without any complications. Okay? Now, a cervical spine fusion is a relatively common procedure. It is millions of people have this conducted every single year. And so right here locally, I'm going to use this first example. At BSA Hospital, right here in Amarillo, they also perform this procedure pretty routinely and at a fairly high success rate as well. But I want to start out with the cash rate, okay? If you're uninsured and you need a spinal fusion, a cervical spinal fusion, and you go to BSA to get this done, I'll tell you right now, the price, and these are all prices and payments listed on BSA's website. The price for an uninsured cash pay patient is $55,097 for this DRG 473, this spinal fusion. Okay? Now, how's that for a deal, ladies and gentlemen? $55,000 cash. Well, you need a little bit more information than what the cash price is. So, let me back up a second. If you go have a spinal fusion at BSA Hospital and you were covered under a United Healthcare PPO plan, then guess what United Healthcare is going to pay BSA? They're going to pay BSA $56,000, $56,725. Now, listen, what United Healthcare is going to pay the hospitals more than the cash pay rate for the uninsured, and that's just crazy. That's just crazy talk, but it's what their prices are posted. Now, if you go to BSA and you have that procedure done and you're covered through a Blue Cross Blue Shield PPO plan, it's the same procedure, same DRG 473, but Blue Cross Blue Shield pays BSA $23,513, ladies and gentlemen. Now, that is a 241% variance in the price. It's a huge price difference, okay? Now, if you're covered on one of Blue Cross Blue Shield's HMO plans, not their PPO, but their HMO plans, the total price that gets paid is $13,771. So we've gone from United Healthcare paying $57,000 to Blue Cross Blue Shield through their HMO contract paying $13,771. Okay? Now listen up. It gets even better. You folks out there that work at cities and for municipalities, a lot of municipalities out there in the Texas Panhandle, you guys are getting your insurance through TML, the Texas Municipal League. So for you city employees out there, if you're covered by TML and you go to BSA to have this procedure, same DRG 473, your TML plan is going to pay BSA approximately $47,830 for the exact same procedure. So you can see, we're all over the board, okay? We had prices ranging from $57,000, which is what United Healthcare's PPO contract pays, all the way down to $13,771, which is what Blue Cross Blue Shield's HMO contract pays. Guys, that's huge. That is a variance of 414% on one procedure at one hospital. How about another facility? It ain't just BSA, guys. Price variance don't just exist at Baptist St. Anthony's. How about a total knee replacement procedure over at Northwest Texas? Okay, let's cross the street. Variance doesn't just exist at BSA. We're going to look at a DRG 469. A DRG 469 is a total knee replacement, so a completely different procedure. If you have that procedure done at Northwest Texas and you're covered on a, let's say, a PHCS multi-plan, PHCS is a very common network. The total price paid, ladies and gentlemen, $105,135. $105,000. Now, if you're covered under a Blue Cross Blue Shield PPO plan, the price drops to $52,120. If you're with Aetna, $35,907. And if you're with United Healthcare, $31,575. So once again, guys, price variance doesn't just exist at one location, one hospital. The price range for this procedure, this total knee replacement, extends from $105,000 paid down to even as low as $25,000 some commercial health plans are paying for a total knee replacement. Once again, we see a price variance of 420% on one procedure. Here's a good one that'll get your attention. How about price variance for a normal newborn baby? A normal newborn baby, okay? That's a DRG 795, a normal newborn. So no C-section here, no complications or anything like that, just a normal newborn, DRG 795. At BSA, if you're covered under a United Healthcare plan, that price is $2,879. That's also the same price if you use Cigna as your health insurance company. But once again, we see Blue Cross Blue Shield PPO plans, the price drops significantly to $1,294. And if you happen to be on an HMO plan, the price drops even more, down to $709. The cash pay rate is $2,900, so it's even higher than any of the health insurance rates. But once again, we see another price variance in the area of about 400 to 410%. Now, ladies and gentlemen, this information, this price variance information, helps companies and families make better purchasing decisions. This kind of information is the type of information that we use to advise our clients and to help people find more affordable and high-quality health care. But this information, at least right now, is just not readily available to the public. So at Butler Benefits, we license data analytics platforms that allow us to access this kind of information. And this is how this is the type of tools and resources that we use to advise companies properly, by sharing with them information on how to reduce their healthcare costs while simultaneously improving their benefits. When you have price variance of 600% or 400%, there are savings to be had just by finding the lower cost facilities and locations within a PPO or an HMO network, right? But guys, price variance doesn't just exist at hospitals either, okay? Another place that this kind of variance is even worse is in retail pharmacies. Places like Walgreens, CVS, Walmart, United Supermarkets, Sam's, whatever pharmacy you go to. Extreme price variance exists within these retail pharmacies. Here's an example. Atorvastatin is a great example. Now, atorvastatin is generic Lipitor, which treats high cholesterol. And it's estimated that there are more than 35 million Americans who are currently taking a statin to control high cholesterol. Okay, so let me just show you the price variation here. The price for atorvastatin right here in Amarillo, if you fill that prescription at a United Supermarkets or an Amigos or a Market Street, the price for atorvastatin is $4.38. $4.38. So remember, folks, if you're on a high deductible health plan with no prescription copays, these are the prices that you actually pay. So $4.38 at United facilities, okay? Now, if you're covered under a plan with copays, I want to make one other point right here. Let's say that you have a copay plan and you have a generic copay of $10. Well, guess what you just did, ladies and gentlemen? You just paid a $10 copay for a $4 medication. Now let that sink in for a second. That's why we had the episode a few weeks ago about it's not always prudent, it's not always the most efficient way to source your services or your drugs by using your health insurance. If you have a plan with a $10 copay on a $4 drug, well, you're wasting money, okay? Now, if a person takes that same medication, back to the price variance, the same medication, atorvastatin, if you filled that prescription at CVS, ladies and gentlemen, the price skyrockets from $4.38 at United to $30.26 at CVS. That is a 691% price difference from one pharmacy in town to another, okay? This is a staggering, guys. Now, to put that in perspective, I want you to imagine paying 6.9 times more for other things in your household budget. If we base that on current prices in the market, this would be the equivalent to paying $21.55 for a gallon of gasoline, $30.27 for a gallon of milk, $12.16 for a loaf of bread, or $7,663, ladies and gentlemen, for the latest iPhone on the market. Now, last example. It would also be like paying $490,000 for a brand new GMC Yukon. Who's going to pay $490,000 for a GMC Yukon? Nobody. Who's going to pay $7,600 for a brand new iPhone? Nobody. Nobody's going to do that knowingly and wittingly. Yet every single day, people are buying healthcare and purchasing healthcare at these kinds of prices simply because they're unaware of the price tag. Most people, frankly, aren't even concerned about the full price tag of healthcare because they're only concerned with their copay or their deductible. But people should care, and they better start caring, Because ultimately, ladies and gentlemen, whether it's directly or indirectly, we pay for healthcare services. We pay through higher premiums. We pay through higher taxes, lower wages, less disposable income in our households. Every time that we overpay for healthcare, we're giving health insurance companies excuses to raise your premium year over year. And so people are just simply unaware. But ladies and gentlemen, it's time to stop being unaware. It's time to stop being unaware. We have to stop using the being unaware as an excuse to doing nothing. Okay? It's time to start treating healthcare like every other business unit in our companies and organizations with strict management and oversight. Okay? Our employees need it now more than ever. When inflation is high, where we can help people is by lowering their healthcare costs and their out-of-pocket costs. You business owners out there, you can't possibly even expect to do this without specific information and data, okay? You can't manage what you aren't measuring. So start measuring, right? When you start measuring, you can start managing these costs. There's so much opportunity here in these areas. When there's, again, like I said, when there's 691% variance just in the price tag, it's the same products. There is enormous amounts of opportunity to drive down the unit cost of healthcare. And that's what we do at Butler Benefits for employer groups. We do it for families. And because we're saving so much money, we're pouring it back into plan designs that eliminate deductibles, eliminate co-payments, eliminate patient responsibility. And that's solving a massive problem that we have in healthcare, okay? You families out there, you can't be expected to save money, be a better consumer, without information and resources, okay? But information and resources is readily available in the marketplace. One thing that you all could do as employees and families and covered people under health plans is start asking your employers who sponsor your health insurance plan at work, start asking them to become more proactive. Help them become more proactive. Share this program with them. Share this episode with them, okay? Tell them that there are ways to get data and information so that they can make better purchasing decisions. You cities, you counties, you school districts, you public employers out there, you're wasting taxpayer dollars needlessly. You could be, and you should be, constructing benefit plans that leverage this type of data and information and safeguarding our taxpayer dollars. Okay? I can guarantee all of you public officials one thing. I can guarantee you this. Okay? You can go pull your claims data and your claims information and find dozens and dozens of examples where your health plan has simply overpaid by 4, 5, 6 times what it could have paid with just a little bit of data and information and education. You folks out there that are covered under high deductible HSA plans, this is extremely important because you got to pay for these services out of pocket, for these prescriptions out of pocket before your health insurance will cover you for anything, okay? Where you get care matters. What you pay matters. You wouldn't pay $30 for a gallon of milk, and you wouldn't pay $7,600 for an iPhone either. Even if you could easily afford it, you wouldn't do it out of principle. Yet every day, this is how we're purchasing healthcare. Ladies and gentlemen, price variance is a real thing. Price variance is a real thing, and it's one of the reasons because prices have historically been hidden from consumers that the system, the industry is allowed to get away with this. That's going to do it for this week on this edition of Snowball's Chance in Healthcare. Folks, ask for prices. Get out there and utilize your resources, your mobile apps. Utilize your consultants and your brokers that work for your employer groups. If they're not helping you mitigate the unit cost of healthcare, if consultants aren't working to lower the unit cost of healthcare, then what are they doing? They're basically just selling you insurance, okay? The transition of risk, yes, selling insurance is a part of that. But another big part of it is if you can't lower the unit cost of healthcare, you don't stand a chance. You don't stand a snowball's chance, ladies and gentlemen, in ever reducing your health insurance premiums. So just remember, all roads lead back to an organization's ability to impact the unit cost of care, the frequency or the severity of claims. I'm Josh Butler, president of Butler Benefits and Consulting, and once again, thank you for joining us. Thank you for listening in. Every week, we're here, we're sharing tips, we're sharing strategies, we're sharing solutions to give you and your organization a snowball's chance in healthcare.